Come one and come all to my podcast tonight. And I hope you guys can hear me okay. Maybe you can let me know in the chat if there's anybody there. You can let me know in the chat that if you can hear me or not. Let's see. I'm going to go ahead and cut that out and go ahead and go. So far, I'm the only one. Okay. Well, I can talk to you guys about a little bit about my day and then tell you that Dr. Shannon thought the podcast was 2 hours ago. So I'm going to have to do a recording with her later and then put that up. But I just thought I can talk a lot about this subject just myself, so I'm happy to do it. It's not quite time yet, so I'm going to wait. But as far as my day went, I hope your day went really well. My day, I found out that silver is through the roof right now, which is crazy. So I went to my chiropractor's office and he had buckets, like barrels of old x-rays, which I guess contain silver. And he's going to kind of take them somewhere and get the silver out of them because it's lucrative to do that now with old x-rays. Who knew? And let's see, that's one magical thing. What else happened? I took my little pony out today, my little old guy. He's 21 now. So it's like, oh my gosh, how did the years go by? I got him when he was 4. It feels like, I know it sounds like I'm old. Well, I am old, but it was just yesterday. Well, I'm going to talk to you guys today. I don't see if there's anyone. I think there might be one other person. There's not so many. I was going to wait, but I was going to talk to you guys today about the affordability of veterinary care. And I'm just talking about in America, but I think the corporations have gotten to other countries, like actually in Canada, affordability is an issue too. And so I'm just going to talk about it just from a local standpoint, and that is that it is not uncommon now to see people's bills in the thousands of dollars for something that really years ago, not too many years ago, because it was within my career, it was only that you would basically, maybe it would be a few hundred, and now it's a few thousand dollars for kind of this similar thing. And I just wanted to talk to you guys about how you can interact with the veterinary community to keep your bills lower. There's certain things you can talk about and say, and I think that there's a way to sort of speak to your vet that might help a lot. It might kind of bring us back to what things used to be like in the old days. In the old days, we used to think, gosh, these old timers don't practice very good medicine. They just kind of give an injection or give a pill or something like that, and they have really like terrible records. But actually, I kind of want to go a little bit back to that now. And if you read any of my books, you will see that I've kind of glorify a lot of those old time vets. Ones that I used to kind of think, oh, they're not practicing the best quality medicine. But here's the thing. If you take your sick animal, say, and I can give you specific examples, but you take your animal into the vet, you basically could take them in for, say, a digestive problem. And at that point, what's happening now, and especially in corporate veterinary medicine, but if your veterinarian is probably like, I'm going to say under 40 years old, like under 35 for sure, but under 40, they are trained to, number one, they're trained to cover themselves. So what that means is they have to give you a poor prognosis, and they have to offer you a very high level of care. Technically, we're practicing excellent quality medicine when we offer, say, contrast series or x-rays, or right outside the gate, right out of the gate, just your dog has diarrhea and all of a sudden it could be $10,000. It's like, it's just diarrhea. In the old days, you got a shot, we see how things go, maybe just a bland diet, maybe just NPO or not feeding the dog for a day, and that was all it was. But now it really could be thousands of dollars. And when your pet is sitting there, in your mind, you're thinking, well, I want to do everything I can. So what does that really mean? I mean, for me, that means that, you know, it just means you're at the vet, you're getting care. Maybe you're getting fluids, maybe you're getting antibiotics. You don't have to do, you know, thousands of dollars of diagnostics right out of the gate. You could wait a couple days and see how things go. So that's my number one kind of take home message for people is to save money, you know, just try something. Just have the vet send you home with sucralfate, or, you know, maybe even just a little fluid pack under the skin if it's a cat or a small dog. It's hard to give enough fluids under the skin for a larger dog to make a difference with something like digestive issues, but fluid therapy is probably one of the best things Western medicine ever gave to medicine. It's saved a lot of people over the years. So let's see, is anybody with me? I see people, but I see that nobody's, like, some people aren't on the chat. So let me know. So if you just push the chat button, and you can let me know that you're here and where you're from. So I'm just talking about working up a digestive case as an example. And if you guys have any specific questions about your pets, please let me know. So we can even take it up a notch. Say you have a cat that's been limping. Now, can a veterinarian say for sure that limping in a cat is not caused by, you know, end-stage bone cancer? Bone cancer is really not as common in cats as it is in large dogs, but no, he or she can't. And so that's where it comes into, like, where we're practicing at this high quality, high expense, high level pet care. And so as a consequence, people think they can't afford their animals. Like, I can't afford the vet care. That's what they say. And so they're finding homes for their pets. Do you know anyone who's found a home for a pet that you know? And that is just so sad to me. I mean, I know our economy is not great and things like that right now, but still finding a home for a beloved animal is just heart-wrenching. So yeah, let's take it up a notch. So say you have a limping cat, limping for maybe a few weeks, and you're like, this could be something more serious. And you're thinking maybe fracture or something like that, a sprain. And every time really, like, a veterinarian might see a limping animal, and they might think, oh, I've got to do all these different x-rays and I have to do all this imaging. Maybe it's not just x-rays. Maybe it could be other imaging studies. And what you can do is you can just see what the vet thinks. Like, what would the vet do if it were their pet? That's always an excellent question. If this was your pet, what would you do? And they may, you know, a lot of vets can't afford vet care any more than you can. So they may say, well, I would just try an anti-inflammatory for a couple days and see how that goes. Well, how holistic medicine could feed into this quite well, because holistic medicine could say, okay, let's say you have a pet. Let's go back to the digestive example. So you have a pet with a digestive problem, and in holistic medicine, we might read a pattern of imbalance in that pet. So we may look at the tongue, look at the pulses, and we may say, okay, this pet has a spleen Qi deficiency from a Chinese medicine standpoint. And, you know, you find out that hi, Cheryl. I see one. Thank you. Appreciate that. One person in the chat. Anyway, more people can come into the chat. I hope that would be really fun. Anything you have a question about, Cheryl or anyone else? Anyway, talking about how to integrate medicine to make it more affordable. That's where I'm at right now. So right now, like I was saying before, if you have a pet with a digestive issue, you might get talked into a lot of thousands of dollars of diagnostics, maybe IV fluids, this and that, and you may not need all that. It's, you know, it's just, so remember that veterinary medicine is a business. It's become a business, and it's also really hard to work with one vet because of corporate practices A lot of vets don't want to work for corporate practices, and if they do, they're getting floated. So what that means is they're going from clinic to clinic to clinic within the same, so like if it's a Blue Pearl group or a Petco group, anyway, whatever it is, as far as the corporate ownership, they'll float vets, and that means to you that you won't necessarily get the same vet twice. And so that's really frustrating when you're trying to work with a case. Even as a vet, that's frustrating. But how you can integrate things is pretty awesome. So you could take a spleen chi deficient animal, saying before that you could over here work them up and get, spend $5,000 on workup and maybe IV fluids. I mentioned that IV fluids can save a life if the pet is really, really bad, vomiting everything and not eating anything, and basically like really, really sick. They will need IV fluids. But if they basically look pretty normal and they just have these ongoing digestive issues, maybe we could come over to this category over here, which is, let's use some herbs and see if we can get them better with herbs. And maybe we use homeopathy and herbs, and maybe we do acupuncture. In my practice, I've never had, I know this is bad to say, I've never had a digestive case I can't solve. If it's not a food allergy, it's one of these patterns of imbalance as far as a chronic case. And I'm mostly talking about, holistic medicine is about treating chronic disease. So most of the time, but let's say we have a dog that's had diarrhea for a week and there's not been any foreign body, nothing's been eaten, like something terrible like pine cone, plum pit, eating part of a tree or whatever that could be plugging up the digestive tract. So nothing like that needs surgery. It just has like intermittent diarrhea, doesn't feel very well, isn't eating normally. That's a great time to go NPO, so no food for 12 to 24 hours. During that time, you can give them a dose of Nux vomica, which is a homeopathic remedy. You can give them a dose of arsenicum album, homeopathic remedy, both of those 30C. Does everybody know how to do homeopathic remedies? So you want to do 1 or 2 pellets by mouth for a digestive issue like that. It might be every 2 hours. Maybe, it would be every 2 hours. So that could be for vomiting or for diarrhea, because as long as they're NPO, not eating anything, it's a great time to do homeopathy. So I would start there, and I love those 2 remedies so much. Nux vomica is good when they have garbage gut, they got into something they shouldn't have, and you just have this ongoing digestive issue. But arsenicum album is more sort of like a constitutional, like an inflammatory bowel situation that is starting to develop, maybe food allergies, things like that. So both of those can be very effective during the NPO stage. So another way so homeopathics cost $7 each, or maybe now it's $9 or something. Cheryl, if you wanted to weigh in on how much homeopathics cost, I'm just not sure these days, but it's definitely like nothing very expensive. And then let's say you do the homeopathy, and it could just completely cure your problem within a day or 2, and then you're fine. You still want to do, always in the back of your mind, you want to think, could this have been caused by the diet in some way? Could the dog usually it's a dog. Could the dog have eaten a food that really he shouldn't have eaten, and maybe we have to change the diet? If this happens more than twice, we definitely have to change the diet. So just getting the diet better for that particular patient, using some homeopathy, now we just cut our veterinary costs and just hugely cut them. So some of these cases, they need to have herbs long-term added to their food. So they might need slippery elm, they might need marshmallow root. I have videos on marshmallow root on my YouTube channel. They might need a bland diet, which would be kind of a rice-based diet. Some dogs are allergic to rice, but usually rice-based diets work. I don't use chicken and rice anymore because we have so many chicken allergies. I go to more like a turkey and rice, something like that, 50-50, and really cook it well. And then see if I can get things better with just a bland diet, feeding small amounts for 3 days, and a little slippery elm, a little marshmallow root, and I'd use a dose of 1 teaspoon of the powder per 20 pounds of body weight twice a day. So let's see, those are 2 easy things. Acupuncture is really good for the digestive tract, and obviously, I mean, it isn't cheap, but it's a lot cheaper than thousands of dollars of testing. So anyway, acupuncture, there's certain acupuncture points that really help with digestion. What do we have? We have a question about potatoes. Oh, you know what? I don't know why I didn't know. Okay. What about potatoes instead of rice? Ooh, that's a good question. Thank you. So yeah, some dogs do great on potatoes, like a turkey potato diet or a fish and potato diet, and a lot of, those, they do fine. I think I like sweet potatoes better generally, but sweet potatoes are higher in potassium, so it just depends. Potatoes are from a family that is toxic, like it's the nightshade family, right? I mean, when I say it's toxic, I mean way back. Now they've been hybridized to take I think they're glycosides out. So sort of, I have to put that in the back of my mind about potatoes, because some patients do great with them, but like when we're talking about a cat, I don't think the cats do very well with potatoes. You guys could chime in if you think differently. I'd love to hear a different thing. But yeah, I think sweet potatoes are good. I think potatoes can be great for a dog. It just depends. And so when you're doing a bland diet, a nice thing to add after, say, the first day might be a little goat milk kefir. You guys, goat milk kefir is high in Saccharomyces. And Saccharomyces is it's a yeast that we usually think of like in the wine industry, or we think of as a leavening agent for breads, for like sourdough, I think. But it competes with bad yeast, so candida, and it competes with it can build up healthy bacteria. So it's a healthy yeast, it can build up healthy bacteria. So it's nice to add, even if we add like 1/4 teaspoon per 10 pounds of body weight per day, and add that to the bland diet. Now we've got a little probiotic coming in, assuming the dog doesn't have allergies to dairy. We have a little probiotic coming into our bland diet. So do you see how like this is a way of strengthening the digestive tract? And a lot of people think of doing probiotics from a powder or a capsule, that sort of thing. And I like to do them from food. So whether I really like to do them from the goat products, because we do see a lot of cow dairy allergies, but not so much on the goat side of things yet, at least not that I've seen. Other food-based probiotics are miso, and a lot of dogs do well with miso, but very tiny amounts. And tempeh, a lot of dogs do fine with tempeh. And I mean just like small amounts. A teaspoon or 2 added to a bland diet. Does anybody have any questions about that? It's only 3 people. Okay, that's okay. Let's see, what else can so I mentioned how to use integrative medicine to keep, for a digestive case, to keep things affordable. Let's move on to a different kind of case. And if you guys have any suggestions in the chat, let me know. But I'm thinking of a case like cancer. So, we don't like to talk about cancer, but I think we need to talk about cancer, especially when it comes to integrative veterinary medicine, because I think the treatment of cancer, there should always be some integrative veterinary medicine available for people. I know that there's not, but there should be. So whether it's on the way of like herbs to help just support the chemotherapy, herbs to, yeah, okay, good question. I'll get that to that in a second. I'm just talking about chemo or talking about cancer therapies right now, but I'll go back to that question in a second. So whether we're talking about helping the pet just handle the toxicity of a certain treatment. So like I've had cancer patients where they decide to do chemo and radiation, and that's fine. And then I was just more in a supportive role. Both, like as soon as those treatments were done, I could kind of get in there with my herbs, but I could also just get in there with my herbs to support the digestive tract or support the immune system so that it could handle those treatments better. Going back to Cheryl's question here, she said, you had mentioned that we could freeze the kefir. Is that correct? And this is going back to digestion stuff and probiotics. Yeah, we can freeze the kefir in small little, I like those little champagne ice cubes. Those are awesome because then we're just getting. So the thing about food-based probiotics is you don't need very much. Like how much sauerkraut do you need? Now sauerkraut we usually stay away from for dogs and cats because it has a lot of garlic in it. But some sauerkraut doesn't, and it would be great. We used to have the Firefly, I don't know if it's still available, but the Firefly sauerkraut in Seattle, and I used to put dogs on the caraway. It didn't have garlic and it had caraway in it, and the caraway sauerkraut was just great for them. And sauerkraut, you could just use, literally like 1/8 of a teaspoon per 20 pounds of body weight. And you would be doing so much more live organisms than if you get like half a bottle sometimes of some of these probiotics that I wonder if there's very many live organisms still left. That's good though. Just keep shooting your questions. Thank you, dear. So getting back to the chemo. So that's, I try to be supportive sometimes with cancer, but let's talk about cats. Cats, they don't do well with chemo. I have not seen a cat do well with chemo like in my whole career. So maybe you guys, if you have something to add to that, please do. If you have a cat that does great with chemo, I'd like to hear about it. But people sure get talked into it a lot, and they sure do it a lot. But those cats, like, I've never seen one make it more than 6 months. As a flip side, using herbs, acupuncture, diet, mushroom therapy, I have seen cats go years regularly with bad cancers. Lymphoma, I have a couple cases of lymphoma on my YouTube channel. I have one where you can see pictures of the tumor shrinking. If you guys want links to that, you just email me or make a comment, and then I will send you a link. I can even provide one in the description. But anyway, that's why I did a whole video on treating cancer in cats, because I was like, okay, number one, it's way cheaper. Number two, it's way more effective. 3, it's way less toxic. Maybe not in every case, because some cases really do need surgical resection and, ongoing, like Western medicine care. But I think that holistic integrative medicine for primary care for cats for cancer is really great. It's usually quite effective. And, it depends, a lot of it depends on how successful you can be with the diet. Diet changes are huge. I see a lot of people in the chat I see a lot of people attending, but that aren't in the chat. So if you guys want to tell me your name and where you're from, that would be really fun. Anyway, anything else we want to talk about? It's basically like, okay, rules. When you go into the vet and you don't want to spend that much money, or maybe you don't have that much money, you can say to them, hey, is there anything you can give my pet that would just kind of get us through a few days I can see how he's going to do? And in that few days, you can kind of research the symptoms and signs and see, what do you think? I feel like it could be more of a collaborative effort than it is, right now. I feel like it's just kind of people really handing a lot of money over to their vets. you can tell I'm very skeptical about corporate veterinary medicine. When your boss is your shareholder, that's a tough situation when it comes to healthcare. And I realize that that's the way it is, but I also want to say, I think it's going to change. I think that people are waking up to this, and I think that I think that vets coming out of school could easily set up an old practice where you don't even have x-rays. You don't have to do surgery. No x-rays, no surgery. You know what you do? You're there with appointments talking to people, but you charge for it. So that's the one thing I want you people to realize, is that you want to pay your vets, especially those of us that are self-employed. But even, it's not that you don't want to pay your vets, it's just that you don't want to pay thousands of dollars for a test right out of a gate. So many times time tells you everything that, say, an MRI is going to tell you. When I say time, a week or two. Like, okay, let's take kind of worst case scenario. Let's take a seizuring dog that's seizuring a lot, or a seizuring cat. Can a vet say for sure it's not a brain tumor if the dog is over 5 years old? Well, absolutely not. You can't say for sure without doing an MRI. Is it, in my opinion, worth doing an MRI? Will the diagnostic test change the way you're going to treat the animal? I'm talking mostly about conventional medicine now. So a seizuring dog, say seizuring a couple times a day, it's pretty serious. And the dog's never seizured before, and it's right on the borderline, so it's 5 years old. You could, and of course you have a seizuring dog, so everyone's like, here's my bank account, just take the whole thing. I'm like, no. So you could just try treatment and see how the dog goes. And I know you don't know if it's a brain tumor or epilepsy. And in Chinese medicine, there's a number of different other conditions that could be within epilepsy. We break that down into further categories. I guess I'm just saying, treatment time tells you. So if it's a brain tumor, it is going to start seizuring more and more and more, even if it's been on medication. And if it's just epilepsy, then a lot of times the drugs do help. I like to keep the low dose because I like to use herbs as well, and that's what I love to do, is just adding in herbs at the same time as we're doing some low dose medication. To me, that is just a really perfect solution. And then a lot of those epilepsy cases are food allergies, actually. So, anybody have any other questions for me? I hope anybody get it? I hope people got something out of it. Again, just kind of summary, and then unless I see more questions, let me just check the time. Okay, yeah. So just a quick sort of update on it. First of all, holistic medicine. What do we treat well? We treat chronic disease well, like most of the time. If you have a chronic disease, there's almost always some treatment, even if it's a side treatment or an adjunct treatment to your Western medicine. That's okay. We can usually either help with the medication, how well it's working. We can offset the side effects of the medication, or we can be the primary treatment, and we can often treat the problem just with herbs or acupuncture. So there's different ways to go, for sure. And there's not a right and a wrong. It's just kind of what works in a certain situation. So that's my sort of takeaway, is just, you don't have to spend all this money right out of the gate most of the time for diagnostic tests. You can, especially if you're working with a holistic vet, kind of say, hey, what do you think about this? A holistic vet also can act as a second opinion. So, it's great to get that second opinion, especially if it is an independent source, someone who's not invested in that corporate practice, say. Just, an independent voice. I think it's good to, a lot of times people come to me and they say, well, the vet wants me to do this and that. And I go, well, that's a good suggestion. What do you want to do? So I think it's good to, I think it's good to stay open. And as for vets, it's really important for us to stay open. I mean, to other new ideas. I didn't get taught about how to treat digestive problems in vet school the way I treat them now. Not at all. And the only thing I can say about vet school is I think that I use the surgeries. A lot of the surgeries are pretty much what I do and try to, if I'm still going to do surgery. I haven't done it in a long time, but I may start again. And yeah, vet school was great for that. But once it comes into like treating chronic disease, I'm going to try to find something without side effects and something that actually has the potential of curing it rather than just suppressing the symptoms. That's kind of what holistic medicine can offer in general. And then how to integrate is just, it's almost like a fine art. But, and we're all learning. That's why we call it practice. I think staying open and realizing that there'll be a case that, maybe we should have used more aggressive medicine. Well, what's happening now is people aren't getting the other option. It's sort of like it's all aggressive medicine. And above all, do no harm has kind of fallen by the wayside. At least that's what I see. I see a lot of animals that, maybe they're even on their last legs. An 18-year-old cat that really just should be euthanized because it's had kidney failure forever. That's okay. But I think sometimes the animals kind of are suffering because we can't let go. And that's like maybe a separate podcast. And it's, so it's a balancing act. I mean, I'm always learning. And you guys, you clients of mine have really taught me a lot and still continue to do so. And it's pretty fun. Anybody have any other questions, comments, thoughts? Anybody who's still in the chat? I see 3 people. Hey, you know what? I'll see if any of you guys are my mom. Sorry about this time too. What happened was Dr. Shannon was supposed to be with me and she thought it was 2 hours ago. So, that's too bad. And I'm going to still do it with her, just like I did it with Dr. Jean when that podcast didn't work. I just went ahead and put that up. So you guys, my podcasts that I've done so far are up. So Dr. Deb's, hers is amazing. How do you treat rage with herbs? That's crazy. Like, who does that? She does that. Or what looked like rage, I guess. How do you, and then with Dr. Jean, that podcast blew me away. It was all about like, how AFCO got to where they're at and how the Pet Food Institute has really have such a huge problem with the Pet Food Institute and how much power they have within AFCO. And so it's led to a lot of times, you guys, commercial pet food can cause copper excess, liver failure, liver disease in dogs. Commercial pet food is supposed to be like, oh, it's all balanced and pure as snow and perfect. And it's like, and Jean explains why. And so all those dogs with unexplained liver enzymes that are eating commercial pet food, I think, good question. Somebody asked about Chi Dog food. Yeah, Chi Dog was thank you, Danielle. Chi Dog was at the Holistic Conference. That was the first I had heard of them, but they were great. That is a great idea. So Chi Dog is a pet food company. What they do is they formulate their pet foods based on the energetics of the patient, which is a cool idea. So like if the patient has a kidney in Chinese medicine, a water personality, they have one food. If they have a wood personality, they have another food. And that's a great idea. And I think the food looks really good. So I like it. What do you think about it, Danielle? Are you using it? You can let me know in the chat. I mean, there's so many good foods now that you can buy. The problem is that they're expensive. So I still recommend homemade food. They're expensive, and I can't always guarantee that they are organic. And I am almost always in a situation where there's tons of, oh, good. She said her dog's improved on it. Good, good, good. And has the dog improved like skin wise, movement wise? You guys, when you change the food, a lot of times you're just reducing the overall inflammation load. So you can help with the way they're walking, with how they eat, how their skin is. She says, oh, she is one wood and fire. Okay, good, good, good. Yeah, so Chi Dog, again, using food to help balance Chinese patterns within a patient. How cool is that? But I mean, I think green juju is really good. You know, I've known Kelly for a lot of years, and she has really gone to a lot of work I asked for her nutrition profiles. They are really fantastic. They way exceed AFCO. And then Darwin's, I've known Gary for many, many years, and he is always constantly formulating, reformulating. I know he's worked with Dr. Barbara Royal and in his formulations, which is great. Holistic vet from Chicago that I have interviewed with when I thought I was moving to Chicago. Okay, Cheryl says, every time I've been to the vet, I've seen so many skin problems, and they are all sent home with antibiotics and Apoquil. I cringe. This is what Cheryl says. I cringe. Cheryl's been a client for a long time. Poor thing. I think I don't know, changed her a little bit, or she's changed me. I do hear them say to give probiotics, but what could these people do? So she's saying, like, there are a lot of skin cases, Donna. What the heck? And what the vets do is just antibiotics and Apoquil, or like a metronome, antibiotics and Apoquil. So what are we doing there? Well, we are suppressing the symptoms with the Apoquil. And now they've said that Apoquil can actually disruptive to the digestive flora. I have to look through my notes and see where that came from. If anybody wants to know, they can ask. But so what antibiotics will do is help with a secondary staph infection, assuming it's a staph infection and not a yeast infection, because it won't do anything for that. And then the Apoquil will suppress the symptoms. And I mean, this is a great way of just not addressing the food problems. And see, most vets don't think there are very many food allergies, and I disagree entirely. I think foods, there are environmental allergies, but foods drive so many of these cases. I've almost never seen a severe skin case that isn't allergic to its food. It's always allergic to its food. So in my course, when I tell people, right away, if your dog has a skin problem, change the food. I don't care what anyone says. And a lot of times they get better. Let's see what you guys are saying here. Gosh, I wish you were here with my chat. I have to figure out how to open this up to people, you guys can be with me on the screen. It would be fun. I'm still learning, you guys. So if you know how to do all this, please contact me. So that was Cheryl's question. Danielle says, I would like to buy the Chi Dog vitamins and minerals to make it at home. She loves her fresh veggies in the recipes. Her skin condition cleared up. She has less anxiety, and she takes CBD as well. And I don't know if you listen to my CBD talk with Rob. That's on my podcast on Spotify and YouTube. But you might want to listen to that if you're already using CBD. It's kind of fun to learn. Like, do you want to do CBD? Do you want to see CBG? It's all these things. Everything's changing there. But yeah, so the Chi Dog vitamins, and you could do it yourself. I don't know why not. Okay, here's a question for you guys. How do you know that a pet is on the right diet for that pet? I know, that's a hard question. I don't even know if vets would always know that. And I didn't know it, except for, I've learned it the hard way. Like, I learned all my lessons. No, the way to know is through doing a urine test. Like, about 4 weeks after a diet starts, you know, that pH should sit there right there in a dog at 6.5. It shouldn't go into the 8 range. So if a dog's on a lot of carbohydrates, a lot of vegetables and carbohydrates and not very much meat, or if the dog is stressed, that's another thing that can weigh into it, but the pH will go up in those situations, making them more prone to bladder stones, certain type of bladder stones, super common, and also urinary tract infections, and also incontinence. So anyway, but I would say try it, you know, 10 pound, a 10-pound terrier. So, you know, I've just recently done this TV thing, you guys, and they're asking me for a food chart for, you know, and I'm asking all my vet friends for food charts, and all that there is stuff that's like basically you have to pay for. It's like there are no food. You can go to, you know, Dr. Pitcairn's. So the old way that we did this, I just want to get into practical ways of, now we're kind of morphing. What time is it? Oh no, we're good. Let's be practical. I don't want to have people telling me that they have to spend $25 a month to have customized diets. I mean, I think that that's okay if you have that kind of money, but you know, on top of all your food costs, to have to pay vets, I don't know. It's just gotten crazy. In the old days, it was always a third, a third, and a third. Say you have a dog that is basically healthy. Maybe your dog, your terrier, has a little bit of a skin thing, or maybe it was a big skin thing. I don't know. But I would always just think that way. Like a third, a third, a third that was Dr. Pitcairn's. I mean, his was a little bit more grain based. So that would be a third grains. So a third quinoa, a third meat, and I try to choose like a novel meat, not chicken or beef, you know, something a little more novel at least. And then a third vegetables. And that was pretty high in carbs for a lot of dogs. But when you checked the urine in a couple of months, 4 weeks, that pH was beautiful. So you had the pH beautiful, the dog had energy, the dog wasn't losing weight, the dog wasn't gaining weight. And then you guys know you have to add calcium, vitamin D to that, and all the other vitamins. And that information is on my website. And anyway, lots of things you have to add to it. But calcium is the number one thing that people don't add. And those dogs did pretty good. I mean, I would say, I don't know, 60, 70% of those dogs did great on a third, a third, and a third. So maybe you want to use quinoa. It's not really a grain. It's high in protein. So a third quinoa, a third veg, maybe a little bit of pumpkin and greens, and then a third meat. And now we've kind of swung, most of us in the raw and homemade food section, to trying to do less carbs. Because I have found that dogs in general do well with less carbs. Not necessarily no carbs. And I know some of you guys might argue with me on that one, but it just depends on the dog. Again, we should be checking the urine if we check the urine pH, and on not just the pH, but also making sure they don't have any crystals already forming, doing a whole UA 4 weeks after a new diet. It's a great idea. So I say try it and see how it's working for the dog. Now we're getting into where we're trying to minimize carbohydrates, and that is a big argument back and forth with the conventional vets that say we need grains so we can prevent ZCM, which is like, doesn't make any sense. And anyway, and the research is not really holding it up, but nonetheless, they all say that. Or are they going to go all the way raw? Most raw diets are like at least 75%, meat, organ meat, bones, and then 25% veg. And a lot of dogs do very well on that. But those little tiny dogs, like you're talking about a 10-pound dog, I would worry that the bones could get caught. Okay, yeah, she's saying. Yeah, so... Oh, a pH test. Sorry, somebody asked just in the chat, like, how do I get a pH test? It's a urinalysis. It will contain the pH in it. So good question. But a tiny dog, so if you have a dog that's under, say, 15 pounds, then you need to worry about whether bones would get caught, whether bones would be too much. A lot of the pet food companies are supposed to stay to 10% ground bone, but they go higher than that. And that's just, if your dog is pooping and there's like chalkiness coming out instead of just like normal poop, then, you know, that's where you can know, okay, I've got too much bone coming into this dog. And it should be, like I say, it should stay at 10%. So with those 10-pound dogs, those little tiny dogs, I think they do better with a cooked diet that's more like a third, a third, and a third. And, you know, you may want to knock that carb back a little bit and do, you know, maybe, sort of like a fourth carb and then 2/3 meat and veg. So anyway, you just have to, every dog is different. So, and so, yeah, there's no cooked diet or even reliably a raw diet chart. You have Karen Becker's stuff, which is great. I think it's maybe the best we have, and hers is all raw. It's quite complicated though. And yeah, Cheryl says you can use pH strips. Yep, so you could use pH strips to check urine. It's true. You have to just make sure that your strips aren't too old, that they're good quality. A lot of them aren't good quality. And you might double check the first one with a urinalysis from the vet and just make sure that it lines up. Like I did my pH at the same time roughly that the vet got the urine. It should be the same. You know, the pH can fluctuate through the day depending on when the dog's eating and so forth. So let's see. You guys are asking some awesome questions. I'm so happy. Let's see. What else can I tell you about that? Oh my gosh, there's so much. Anybody have any other questions about how to use diet or integrative medicine to help prevent going to the vet and spending thousands of dollars? I see 9 of you there, but let me see. I'm just gonna, maybe there's, I'm new to doing this, so I'm just gonna, I think I can see how you guys are shy. Okay, no problem. So yeah, I just wanted to, so in conclusion, some dogs do great with the old third and a third and a third. That was just, yep. Some dogs do great on raw, like just lots of meat, lots of protein, you know, a little, I think I'm kind of like lean more towards raw if I can. It's the ones that are the little dogs that don't always do that well with bones, you know, you need to add calcium and magnesium and vitamin D to their diet. Do you guys know, I'm going to ask you guys and see if you can answer me in the chat. Do you know where a wolf would get vitamin D? Where would a wolf get vitamin D? Would he go to the supplement shop and get a vitamin D supplement? No, he would eat it from what organ or what, I'm giving you a hint, what organ, what part of a prey diet contains vitamin D? You guys know? I'm going to throw out that question and then I'm going to keep rambling, see if anybody answers me, and then I'll try to remember to answer it. Yeah, I've been really just studying nutrition. A lot of people say, oh, Donna, you're not a nutritionist and this and that, but I have been working with these diets and so many dogs have food allergies, like even ones you didn't know were there. And then when we clear them up, you know, lots of conditions get better, especially immune-mediated conditions like thyroid disease, like even kidney disease. Those are immune-mediated a lot of times. People don't realize. Different forms of lupus, and we just will clear different allergies or different amino acids and get those immune-mediated dogs. Okay, nobody is fessing up to where vitamin D comes from. First of all, did you guys know that vitamin D, when you buy it at the supplement shop, it comes from sheep lanolin? I'm not joking. People say, because I'm vegetarian, I'm like, well, not my supplements. I have no idea where that, if I have one of my supplements has a vitamin D and it comes from sheep lanolin, I'm like, I guess I'm not a vegetarian. Well, in an organ system, so with the pets, it comes from liver. So vitamin D comes from liver. It can come, yeah, and it can balance out how much bone they're eating. So there's a calcium vitamin D balance. It's really important. So if you're if you're increasing vitamin D in a pet anyway, I can't say for people, but you want to make sure that the calcium is being raised proportionally. And what happens if you raise the protein level? So you're giving the pet, instead of 2/3 of a cup of cooked meat, you're doing a cup of cooked meat. What do you do with the calcium level? You increase that as well. So it's normally 500 milligrams per 2/3 of a cup of cooked meat, ground. But let's say we give them a cup of protein. Now we're going to have to bump that calcium up. So we're going to bump it up almost to, let's see, we're going to probably bump it up to about 800 or 750, something like that. So you guys, it's really important to know that a lot of these diet stuff, it has to be proportional. Things are proportional to each other. Protein proportional, calcium proportional to vitamin D. Yeah. But I don't want that to scare people. I still think they do the best on the diet that you make and freeze, and it's just a great way to go. But I didn't really know all this when I was doing my own pet's food. I've learned along the way. Okay, so Danielle says that you got the dog from a breeder, and yeah, you spend a lot on pet food, and she's only 10 pounds. Can you imagine if you had a German Shepherd? She's doing well with gently cooked, and we add organs and glands. Okay, so let's talk about organs a minute. I love organ meat, but I like to do it raw. If you do organ meat raw, you are like tripling the nutrients in that organ meat, and you don't have to do as much. So do you guys know that, somebody asked about, the best source of magnesium. Okay, that's a good question. But you guys know that the liver is, if it's raw, it has all these nutrients, but it can also consolidate heavy metals and other toxins. So just like the bone can consolidate heavy metal and toxins. So I want it to make sure it's organic, liver, and heart. Those are my very favorite organ meats. I don't use anything else. I don't use gizzards and this and that. I don't think I'm gonna get much nutrients out of them. I'm really focusing on the liver and the heart. And in a 10-pound dog, you only need like a teaspoon of combination per, I'm gonna say 10 pounds. Most of those guys are eating no more than 2/3 of a cup for the whole day. So, that's going to be maybe 1 teaspoon, if that, of organ meat altogether for the day. And a lot of people do it 3 times a week, so they can give them a little bit more than that. Okay, so the best source of magnesium for dogs. Thank you for all these questions. This is fun. So the best source of magnesium for dogs is, in my opinion, it's my vitamin mineral mix. So sunflower seeds, my vitamin mineral mix that I have people do. Sunflower seeds, pumpkin seeds, Brazil nuts, organic spirulina. All of it's organic and raw. We grind it in the food processor. I think it's 1/4 of a cup of each, and 2 tablespoons of organic spirulina. Make sure you use organic, because if you don't, spirulina is very toxic if it's not organic. A lot of times it's just full of toxins. Super sad, but anyway. So you want to grind in the food processor, keep it in the fridge. A little 10-pound dog's only going to eat like maybe 1/8 of a teaspoon twice a day. It's going to be a good source of magnesium. You can get magnesium from bone if you're doing bone. So kind of, those are the biggest sources that I, just off the top of my head, know. And novel organs. Somebody asked about novel organs. So if there's food allergies, we have to be strict about the proteins, then that means our organ meat has to match the protein that we're eating. So in other words, if my patient is allergic to chicken and beef, then guess what? I can't feed chicken or beef liver. I have to try to get the organ meat to match if I can. But that's only if there's food allergies. If there's no food allergies, then there's absolutely no reason for it. And I know Green Juju, I think Kelly puts in duck liver or something like that, but I can't remember what kind of liver it is, and maybe it's lamb liver. But she mixes proteins a little bit, but not as much as a lot of the foods do, but and that's not a problem at all. It's actually good nutritionally. It's only when we have food allergies that we have to be careful about putting in too many different protein sources, because guess what? That's more that the immune system can react to. So that's why if you guys watch my video on protein switching, and I talk all about how the immune system reacts to proteins of different varieties, and of course those are all amino acids within each protein. Each protein has its own amino acid profile, and I spent a lot of time studying that. I love amino acids, but that's another story. Let's see, anything else? Any other questions you guys have? You guys are great. This is fun. We should do it again. I'm sorry that Shannon couldn't be here. She and I are gonna do a separate, not live type situation and see if we can get that together, and then I'll put that one up on my Spotify, my YouTube podcasts, and I'm trying to work with Apple. I don't know how to do Apple podcasts very well. It's not working for some reason. Anyways, so the easier way is just for me to, I'm still, I don't have anyone helping me. Like it's just me. So if you guys get frustrated and realize my podcasts don't always work out, it's because I'm still learning how to do them and don't really know how yet. So I'm trying to have some patience with me. And if there's any topic you guys want to do, I mean, I have 3 more scheduled. I have Dr. Rob's coming back for a live podcast on February 5th. I think it's at 3 p.m. Pacific time. And so he's going to come back and he is going to talk to us all about mushrooms, all the different parts of mushrooms, and he is just unbelievable. And I've known him, as you guys know, since the 90s. Me and Rob go way back. So Rob, that's going to be February 5th at 3. The next 2 podcasts, I know the one with, Dr. Kim, she's the president of the Veterinary Botanical Medical Association. She's going to be here on Thursday the 19th at 3, I believe. And you guys can check I might try to put these up. I put them up in my holistic pet group. I think I have Doc Donna's holistic dog group or something. And I can put those up there. And there is another one. Anyway, I'll put those up though. So I have 3 more scheduled. 2 are going to be live. I hope you guys can join me. We got one more question. So it's about Ziwi Peak. She eats venison along with her chi dog, but it is chicken and turkey. Ooh, okay, be careful if there's food allergies. And that is a lot of different proteins that the dog can react to. You should watch my protein video if you can. And send me a link if you can't find it. It's on YouTube. You got to put in the search, just protein switching, I think it is. And I buy my spirulina from Mountain Rose Herbs. I really like Mountain Rose Herbs. I mean, I don't have any sort of professional affiliation with them. It's just that I can depend on their quality. So I buy my marshmallow and my slippery elm from them, and my organic spirulina from them. I used to buy from Western Herbs, but now we can't do that. We have a lot of herbal problems we have a lot of issues getting herbs into, yay, you rock. Oh, you saw me on Animal Cribs. Oh my gosh, you're going way back. Well, I'm supposedly gonna be on Cairo in the beginning of February. I don't know but I'm not sure if it's gonna get cut or what, because we don't usually sell commercial time in the holistic world. We're not to like Purina or Hills or all of these companies. They basically would not sponsor any of my stuff at all, which is unfortunate. But maybe we're in sort of a situation in America where things are going to start coming together, where we don't always have to be us or them. Like in veterinary medicine with nutrition, it's like you're either in the you're feeding these 4 foods that are safe for DCM, Pro Plan and Hills and Royal Canin, or or you're bad, you know? It's just like, is that really what we're gonna do? Or could we kind of have a more of a meeting of the minds? We're better than that, right? We can be better than that. We don't have to be us or them. I want more of a unity and bridge building. Anyway, you guys, I've enjoyed this time so much. And if you want to do it again, you know, just grab a couple friends and tell me when you want to do it. And I'm happy to get on and do it. And we could do it all about nutrition, because it's like seriously my favorite topic. And if I don't know something, which I'm sure I won't, I will look it up and let you guys know I don't know. So anyway, thanks so much. I hope you guys are well. And yeah, great. Yeah, it's good to hear. Thank you so much for joining me. Thanks for everybody for joining me. Have a great rest of your night. Bye now.